children and teens. As we know, I think one of the vaccines is approved for people down to 16, and there's trials in place for 12 and over, I think, with one of them. But there's still a significant portion of the population in BC that falls into that category. So where does that leave families, children, teens, say after July this summer, when the adults have been vaccinated but the children and teens haven't, especially given that the kids have had a lot of their activities restricted, they've had their sports and social lives restricted. When do they get to have some kind of normal life, and how will families navigate that when adults have been vaccinated and children haven't been?
Yeah, all very good questions, and I don't have all the answers yet because we're still working things out and trying to understand them. But we know that for the most part, young people don't have a severe illness, so that's good news. That means that we have more leeway, even if they are transmitting, to be able to have more activities sooner and not have as great a risk. I'm not saying no risk. We know that some children do have severe disease. We know that some of them end up with long-term complications. So what we need to do, and the aim of the program, is to reduce the amount of transmission in our communities so that we can have all of our activities safely come back to normal-ish. And I say that because it's likely we're going to be dealing with this virus for many, many more months, even years. But if we can prevent people from getting severely ill, prevent hospitalizations and deaths, that is how we can manage the pandemic piece and get back into activities. But as you say, the Moderna vaccine is licensed or approved for use right now down to age 16. We have included teenagers with severe, with some medical conditions in the vaccine program under the group of people who are clinically extremely vulnerable, and more information will be coming out about that. There's a number of people in that group. And there are all ongoing studies. As we've said all along, we are learning a lot as we go, and that includes about vaccines and about how well they work. And when the vaccines are started, the focus was to develop a vaccine that would work in those who are most at risk. So for many other diseases that affect children more so than adults, the vaccine development is focused on preventing illness in children. And I was struck just last week, I happened to be in the legislative library, and it was open to a page from April of 1955 when the polio vaccine was approved for use for the first time in this country. And the headline was "Vaccine for All by the End of the Year." And the analogies with what we're going through right now just really struck me, because it was the same information about how well it protected children who were at risk and how it prevented them from ending up in hospital or dying from polio. And I know my mother and her generation, this was just an amazing change for them, because they could get through the summer without losing their friends to polio. I think, we need to think about this in the same way. These vaccines are new. We're finding out that they work, and they work in the people who are most affected by COVID-19, and that's our seniors and elders. And we're now moving to test it in younger people, and it's likely to be the end of the year before we'll have more data around the vaccination in younger people. But in the meantime, if we can get enough of our adult population and those high-risk settings under control, so making sure that we protect the adults in the school system and that we have some measures in place to reduce transmission in schools. But it will look different, and we are looking at, I think, I can say with some confidence that school for K-12 will look much more normal by next September, because the risks in our community will be decreased by the immunization program. And same for universities. I think we need to start planning that full back into campus and campus life, and those important connections and social and emotional growth that we see in those situations will be back to much more normal. but we will still be doing some things. There will be still some times during the respiratory season where we'll need to wear masks in certain situations, reduce our crowding, particularly if we're somebody who's at risk. And we've seen these measures work for influenza, and I suspect we'll be adding COVID in some way or the other to the types of settings that we'll need to pay attention to. But I fully expect we'll get to a post-pandemic way of looking at that by this summer. And of course, we'll never have to stop washing our hands.